Hello. I want to start today with a question. Have you ever had a conversation with your doctor, specifically about your risk of falling? Not a general reminder to be careful, not a passing comment about watching your step, but a real structured conversation with a screening tool, an assessment, and a plan. If the answer is no, you are not alone. Despite the fact that falls are the leading cause of injury death in adults 65 and older in the United States, and despite the fact that roughly 1 in 4 adults over 65 falls each year, formal fall risk screening using a standardized, evidence-based approach does not happen consistently in primary care for many older adults, which means many people are missing something that already exists, that is free, that their doctor may be able to offer, and that was specifically designed by the CDC to address exactly this gap. My name is Dr. Chen. I am a physician in internal medicine, and today I want to tell you about a program called STEADI, S-T-E-A-D-I. It stands for Stopping Elderly Accidents, Deaths, and Injuries. It is a real CDC initiative launched in 2012 and updated in 2019. Based on clinical guidelines developed jointly by the American Geriatric Society and the British Geriatric Society. And it is something that most people over 65 have never heard of, which is exactly why we are talking about it today. So let us go through it properly. What it is, what it involves, what happens if you are identified as at risk, and most importantly, how to access it. Let us begin. Now, first, I want to give you some context about why a program like STEADI was needed in the first place. Falls among adults 65 and older are not just a medical issue. They are a public health issue with significant scale. More than 1 in 4 older adults falls each year. That is roughly 14 million people annually. More than 3 million are treated in emergency departments each year for fall injuries. And the annual medical cost associated with falls and fall-related deaths has been estimated at around $50 billion. Now, beyond the numbers, there is another important reality. Many of the factors that contribute to falls are modifiable, meaning they can be identified and in many cases addressed. Things like muscle weakness, balance problems, medication side effects, vision issues, blood pressure changes when standing, home hazards. These are not inevitable. They are specific, identifiable, and often addressable. But addressing them requires first identifying them, and that is what STEADI is designed to do. The CDC created it specifically to give primary care providers a standardized, practical prevention for integrating fall prevention into every clinical practice. The materials are free, available at cdc.gov/STEADI, and designed to be used during regular primary care visits. Now, STEADI has 3 core elements, and I want to walk you through each one, because understanding what the program actually involves is what allows you to ask for it by name at your next appointment. The first element is screen. This means identifying who may be at increased fall risk using standardized tools. The STEADI algorithm includes 2 main screening options. The first is called the Stay Independent Questionnaire. It is a 12-question tool that patients can fill out themselves, either in the waiting room or at home before an appointment. It asks about things like whether you have fallen in the past year, whether you feel unsteady when standing or walking, whether you worry about falling, whether you use your arms to stand up from a chair, whether you take medications that sometimes make you feel lightheaded, and several other practical questions about daily activities and movement. A score of 4 or above on this questionnaire indicates increased fall risk and triggers the next steps in the steady process. The second screening option is even simpler. Just 3 questions called the 3 key questions. Have you fallen in the past year? Do you feel unsteady when standing or walking? Do you worry about falling? Research has found that these 3 questions alone identify the large majority of people who would score as high risk. On the full 12-question tool, a yes to any one of those 3 questions indicates that further assessment is warranted. Now, I want to pause here and let you sit with those 3 questions for a moment. Have you fallen in the past year? Do you feel unsteady when standing or walking? Do you worry about falling? If your honest answer to any of these is yes, and your doctor has not formally discussed your fall risk with you, that is exactly the conversation this program is designed to start. And you have every right to ask for it. Moving on, the second element is assess. Once someone is identified as being at increased risk, STEADY includes a structured assessment, looking at specific modifiable factors. Let me go through what that assessment typically involves. Gait, strength, and balance evaluation. This is often done using a simple physical test called the Timed Up and Go, sometimes abbreviated as TUG. You start seated in a standard chair. You stand up, walk about 10 feet, turn around, walk back, and sit down again. The time it takes to complete this provides useful information about your mobility, balance, and functional fall risk. This is not a pass-fail test. It is a tool that helps identify where specific attention is needed and helps track improvement over time. Another balance assessment is a 4-stage balance test, which asks you to stand in progressively more challenging positions: feet together, semi-tandem, tandem, and one-leg stand, each held for 10 seconds. How far through these stages a person can progress gives useful information about balance capacity. Alongside these physical assessments, the STEADY evaluation also looks at medication review to identify any medications associated with increased fall risk, vision, including a basic visual acuity check, blood pressure, measured both lying down and standing, to check for orthostatic hypotension, which is a drop in blood pressure when you stand up. That can cause dizziness and falls. Feet and footwear, because foot problems and inappropriate footwear are a recognized but often overlooked fall risk factor. Vitamin D intake, because vitamin D plays a role in muscle function and bone health, and deficiency is common in older adults. And home safety, looking at hazards in the home environment that could be addressed. The third element is intervene. This is where the assessment findings lead to a specific, individualized plan. The interventions recommended through STEADY depend entirely on what the assessment found. They are not one-size-fits-all. For someone whose assessment shows gait or balance problems, a physical therapy referral is recommended. For someone found to be on medications associated with fall risk, a medication review and possible adjustment with the prescribing physician. For someone with vision problems, an eye exam referral. For someone with orthostatic hypotension, specific management strategies. For someone with home hazards, a home safety assessment and guidance on modifications. And for everyone in the at-risk category, referral to an evidence-based community fall prevention program, such as Tai Chi for better balance, or the Otago exercise program, which we have discussed in previous videos. The STEADY follow-up recommendation is a visit within 30 to 90 days after interventions begin to check in on progress and adjust the plan as needed. Now, I want to be honest with you about something, because this is where the program's promise meets its real-world implementation. STEADY was designed to be used in every primary care practice, with every older adult patient. But research on how widely it is actually being used shows a more mixed picture. In one study of academic primary care practices, about 64% of eligible patients over 65 were screened using STEADY over a 6-month period. After the practices made deliberate efforts to implement it, which means roughly a third of eligible patients still were not screened. Even in practices specifically trying to use the program, in practices that have not made that deliberate effort, the rate is likely lower. This is not a criticism of individual doctors who are managing enormous amounts in a limited appointment time. It is simply an honest picture of why many people over 65 have not encountered STEADY, even though it exists. And it explains why I am telling you about it today. Because knowing it exists gives you the ability to ask for it rather than waiting and hoping it comes up. Now, let me tell you exactly how to bring this up with your doctor, because I want to make this as practical as possible. At your next appointment, you can say something as simple as, "I heard about a CDC fall prevention program called STEADY. I would like to talk about my fall risk and whether this kind of screening makes sense for me." That is it. You do not need to know every detail of the program. You just need to name it and ask. If your doctor is familiar with STEADY, which many primary care physicians are, that question may lead directly to a screening questionnaire and a structured conversation. If your doctor is less familiar with it, you can mention that the materials are freely available at cdc.gov/STEADY and ask whether there is a way to incorporate a fall risk discussion into your care. You might also ask specifically about the 3 questions I mentioned earlier. Have I fallen in the past year? Do I feel unsteady? Do I worry about falling? These 3 questions are the starting point of the STEADY screening, and any primary care physician can engage with them, regardless of their familiarity with the full program. Now, I also want to mention something about STEADY and pharmacies, because this is a less well-known aspect of the program. Research on STEADY implementation has noted that community-based pharmacies may be well-positioned to conduct certain elements of STEADY, particularly medication review, which is one of the most important components. Because pharmacists have deep expertise in medication interactions and in identifying drugs associated with fall risk. If your doctor's practice does not currently offer STEADY screening, asking your pharmacist about a medication review specifically focused on fall risk is a reasonable and practical alternative starting point. Many pharmacies offer this, or can direct you to someone who does. Now, I want to go back to the Stay Independent questionnaire for a moment, because I want to tell you what questions it actually contains, so you can think about them before your appointment and bring informed answers. The 12 questions on the Stay Independent questionnaire ask things like whether you have fallen in the past year, whether you sometimes feel unsteady when you are walking, whether you hold on to furniture when walking at home, whether you worry about falling, whether you need to push with your hands to stand up from a chair, whether you have trouble stepping up onto a curb, whether you often need to rush to the toilet, whether you have lost some feeling in your feet, whether you take medicine that sometimes makes you feel lightheaded, whether you take medicine to help you sleep or feel less anxious, and whether you sometimes feel lightheaded or have periods of loss of consciousness. Now, each of these questions points toward a specific potential risk factor. Some point toward balance, some toward medication effects, some toward sensation in the feet, some toward urgency, which is relevant because rushing to the bathroom is a recognized situation associated with falls in older adults, and some toward orthostatic blood pressure changes. The reason each question matters is not just the total score. It is that each yes answer points toward a specific area that a physician or a physical therapist can then assess and address. This is what makes STEADY a structured program, rather than a general suggestion to be more careful. It is specific, it is individualized, and it is designed to lead to action, not just awareness. Now, I also want to mention something for people who have already experienced a fall, because the STEADY recommendation includes fall risk screening. At any time a patient presents with an acute fall, not just annually, if you have had a fall recently and you have not yet had a structured fall risk assessment, that fall is itself an indication that STEADY screening and follow-up should be offered. You do not have to wait for an annual wellness visit. A fall, or a near fall, or a new onset of unsteadiness are all appropriate triggers for initiating this conversation with your doctor. Now, I want to bring this all together into something clear and practical that you can act on after watching this video. The first thing, think honestly about the 3 key questions. Have you fallen in the past year? Do you feel unsteady when standing or walking? Do you worry about falling? If yes to any of them, this conversation is relevant to you. The second thing, at your next appointment, mention STEADY by name. Tell your doctor you would like to talk about your fall risk and whether a structured screening assessment makes sense for you. The third thing, if you can, look up the Stay Independent questionnaire at cdc.gov/STEADI before your appointment. Think through your honest answers. Bring that thinking with you. It will make the conversation more efficient and more useful. The fourth thing, ask specifically about the timed up and go assessment. If balance and gait are a concern for you, ask whether this can be done during your visit, or whether a physical therapy referral for formal balance assessment makes sense. The fifth thing, ask your doctor or pharmacist to review your medications, specifically with fall risk in mind. Not just a general medication check, but specifically, are any of my current medications associated with increased fall risk? And is any adjustment worth considering? The sixth thing, if your doctor's practice does not currently use STEADY, do not let that be the end of the conversation. Ask for a fall risk discussion in whatever form is available. Ask about community exercise programs. Ask about a physical therapy referral. The underlying goals of STEADY can be pursued even if the specific program is not formally in place at your clinic. And the seventh thing, know that this conversation is appropriate and encouraged. No matter your current health status, fall prevention is not only for people who have already fallen or who feel obviously unstable. STEADY is designed to screen all adults 65 and older, including those who currently feel fine, because identifying and addressing risk factors early before a fall occurs is far better than addressing them after one. Let me close with something I want you to carry with you. STEADY exists. It is real. It is free. It is backed by the CDC and by the clinical guidelines of the American and British Geriatric Societies. And it was created specifically because falls among older adults were recognized as a major preventable public health problem that was not being systematically addressed in primary care. You are now one of the people who knows it exists. That knowledge is genuinely useful because it allows you to walk into your next appointment and ask for something real, by name, with an understanding of what it involves and why it matters. I am Dr. Chen. Thank you for spending this time with me today. If this video gave you something you are going to act on, please share it with a friend, a family member, anyone over 65 who has never had a structured fall risk conversation with their doctor. They deserve to know this exists. Leave your questions in the comments below. I read them, and I will see you in the next video. Take care of yourself.